Dr. Abhijit Kar. Okay, today is your practical class and the topic is urine analysis for normal and abnormal constituents of urine. Okay, what is urine? Excreted fluid. So how is it produced? From kidney. Okay. And then, so what is the color of your urine? Normally? Straw color. Okay. If there is any abnormality, will it change?
Yes.
Okay. What are normal physiological changes that can be found in urine? Normal. Red color. When?
There is a blood mixing. Epithelial lining of the urine.
When? Okay. These are abnormal things. Normal physiologically.
It will get darker.
Yes. In summer season, if you don't drink enough water, darker. And if you drink too much water,
White or yellow.
okay. Okay. Let's say if you pass too much, if you drink, there is a disease called diabetes insipidus, where you have too much amount of urine is passed, so it also becomes dilated. Okay, dilatation of urine. So, introduction. Urine analysis is an important laboratory test. Okay. Laboratory test used to detect, diagnose, for detection, for diagnosis and monitor various metabolic and renal disorders. Okay, if there is any disorder in our body, we can use to detect. Then after detection, we can also diagnose it. There are certain tests which are only for screening, and certain tests which are also both screening and diagnostic. So based on diagnosis test, we can give treatment. So for diagnosis also, we can do monitoring various metabolic. Urine analysis is an important laboratory test used to detect, diagnose and monitor various metabolic and renal disorders. It helps us to assess the functional status of kidneys and systemic conditions such as diabetes mellitus, jaundice, infections and dehydration. What happens in jaundice? Any idea?
Pale color of the body.
Pale color of body. And okay. Okay. So with this sample of urine, with a sample of urine, we can diagnose both disease of kidney and systemic diseases. Systemic diseases means for rest of the body. Okay, rest of the body. So if there is kidney disease, then also we can detect, and if there is problem in any other parts of the body, then also we can detect. So urine formation, what is this picture? Nephron? Okay. So the blood comes there in the glomerulus. From glomerulus, it gets filtered. Then there is PCT. Then first comes the descending, and then comes the ascending. Okay. Concentration of urine. There's fluid, and then again dilution, and then so collecting duct, it gets passed down. So urine, see osmolarity, it is increased. So physical examination of urine. Here we can see it was taught last class, amount of volume of urine normal day. On a normal day we can pass about 1 to 1.5 liter per day. When it is called polyuria, oliguria and anuria. If it is more than 3 liter per day, that is in diseases like diabetes mellitus, insipidus, then it is polyuria. Oliguria is less than 400 ml per day. And anuria is, if it is less than 100 ml per day in acute renal failure. Due to infection or certain diseases, the kidney gets shut down completely. Then it is less than 100 ml per day. Then color is normally pale in color, pale yellow due to urochrome pigment. Then dark yellow is in concentrated urine, and red in hematuria, brown in jaundice. What is hematuria? When can you see red urine? When RBC is present in the urine, then it is called hematuria. So one is when it is too much of RBC blood gets passed down in urine, then it is visible. When it is very small amount, then it is not visible by a naked eyes. Then you have to see in microscope. Okay, now see appearance or turbidity. Normally urine is clear, But if pus is present, then it is turbid, then cells, crystals can be present. What sort of crystals, any idea? Uric acid. There are other sort of crystals also which will come in the next slides. Then odor, aromatically normal. Ammonia in old samples and fruity in ketosis. There are certain diseases in which urine gets a specific smell. Okay. So in diabetic ketoacidosis, do you know what is diabetic ketoacidosis? When a person has diabetes and he is on insulin, okay, but he is not taking any insulin for certain reasons. Maybe it is not there at his home, or he is unable to put insulin in his body, then the level of blood sugar rises very high. Okay, then there is ketone body formation in his body because his body is unable to absorb this glucose. In absence of insulin, GLUT4 will not be activated. Okay, so his body will be metabolizing fatty acids. So ketone body will be produced from that. So this is called diabetic ketoacidosis. Here acetoacetate are types of ketone bodies that is passed in urine in diabetic ketoacidosis. So this acetone will give fruity odor. So a person of diabetic ketoacidosis will be unconscious when brought to you in the emergency from his nose. He will be breathing beta hydroxybutyrate will be released from his nose, and you can, from distance you can diagnose. Once you see, you can diagnose that it is a diabetic ketoacidosis patient. Then Mousy odor in Phenylketonuria, it is a type of disease. Then burnt sugar odor in patient of maple syrup urine disease. So the normal pH is 4.5 to 8. It is a type of disease in which our body is unable to metabolize amino acids. Okay, so this gets accommodated in the body. So in these patients, we will see burnt syrup odor. The normal chemical composition of urine. Normally you can find urea, chlorine, sodium, potassium, creatinine, and other dissolved inorganic and organic compounds like proteins, hormones, metabolites. Drugs is also used, excreted drugs. Medicines, that is, some of these are get metabolized in the liver, some are excreted in the kidneys. For now, the procedure of collection. How do we collect the urine? For most of the analytical purposes, we collect 24-hour urine sample. Okay, for the whole 24-hour, how do you collect? A person if he is bedridden, him or her, then we put a catheter. Then for the whole, we start the clock, empty the bag. For the whole day, for 24 hours, we see at the end of 24 hours how much urine is collected. Okay. So that is for 24-hour measurement. You can measure by this collected urine of the whole 24 hours. You can determine the specific gravity and the total urine output, that is for 24 hours. Then for specific gravity and quantitative estimation of different constituents of urine like protein, sugar, creatinine, and calcium. Others are also there. For routine examination, that is, if you are prescribed for urine examination, let's say you have a high grade fever, then you have burning micturition. When you pass urine, then you have burning sensation. It is most common in females. So in this condition, doctor will prescribe urine for microscopy and culture. For microscopy, you will not be collecting 24 hours. You will they will give a small sample like this. They will give a small collecting vial or this like this pot. So in this you will collect and give in the morning. How you will collect? That is for routine examination. Midstream part of first voided morning urine is used. Okay. Initial portion of urine is discarded while the midstream urine, about 50 ml, is collected in a dry glass or plastic bottle. So when in the morning, just after waking up, you will pass the urine, and from that only you have to collect. Once you have passed the first morning session, then there is no use of collecting. Okay. So how will you collect? First 50 ml around, first initially a little bit of amount of urine, you have to let it flow out. And then you have to collect from the mid part of the urine. So it is collected in the dry or plastic bottle, and the bottle should be sterilized. Okay, from before on it should be sterilized and dry. Then it can be used for culture and antibiotic sensitivity test. Wide mouth glass or plastic bottles with screw caps are used for urine collection. Glass bottles should be preferred. Urine collection containers must be clean and dry. Okay. While collection of urine, the patient should void urine directly into the container. If the urine is collected for the purpose of bacteriological examination, first the urethra must be washed thoroughly and midstream urine should be collected in sterile bottle. It is done to avoid external microbial contamination. So when urine is produced by our kidneys, it passes through ureter and then collected in the bladder. So when it is stored overnight, if there is an infection, then the bacteria or microorganisms will grow over the night. So in the morning, early first sample, you will pass little bit of urine, and then the rest part you will open the cap of this collecting plastic bottle, and then after that, after passing little amount of urine, rest you will collect directly in it, and then you will cover it. Before collecting, first you have to wash the area, perineal area, urethra area. In case of infants who do not cooperate in collection of urine in bottle, the urine sample can be collected in a disposable collecting apparatus. Normally they pass in some places, then you have to pre-sterilize that part, then when they pass you can collect it from there. So there was a case when I was in UG, so a patient in pediatrics, a mother brought her child, so she was complaining that at home he is passing green color urine. Okay, he is passing green color urine for last few days, and when she brought the child at the department, everything is normal. Okay, he is passing normal straw colored urine, and again when he went there at home, again the child was passing green color urine. So after a long period of investigation, it was found that the baby was passing yellow color urine, which is normal, but the collecting part was blue. So the mother interpreted it as green colored urine. So urine color chart, you can see as the dehydration increases, during winter also we take small amount of urine, a small amount of water, so it gets darker. Now how do you preserve urine? Urine should be preserved if it is not used within 1 hour. If you think urine can't be tested now, like in our microbiology department and these laboratories, they can't use the specimen directly for examinations. So they have to store it. So if you have to store it for more than 1 hour, then this should be kept either in refrigerator at about 4 degrees centigrade, or some preservatives must be added in the urine sample to avoid microbial decomposition of organic constituents. If there is some organic compounds that is passed in the urine, like glucose we can pass. In diabetes, glucose will be present in urine. So if you don't add like extra preservatives, then microorganisms, normal peripheral commensal microorganisms will act on it and metabolize this glucose. So you will get, on testing, you will get reduced amount of glucose. Then what is the normal level? So like in glucose, protein, ketone bodies, these are organic compounds that will be metabolized by microorganisms. Then there are cellular components that can be passed in urine, which are used by preservatives to preserve for a long amount of time, like RBC, leukocytes, pus cells, epithelial cells in urine sample. These also prevent microbial growth in the urine sample. The sample of some recommended preservatives are toluene, formaldehyde, thymol, chloroform, and camphor. So determination of specific gravity indicates the concentration of ability of kidney. Normal range is 1.015 to 1.025. This specific gravity is measured by urinometer. What is the procedure? In procedure, we pour urine in a cylinder, float the urinometer, read the scale at the lower meniscus. What is the meniscus? Meniscus, anyone? Due to surface tension, heard of surface tension. So when in a glass beaker or anywhere we pour liquid, due to surface tension, it won't produce a smooth surface. It will be curved like this, or in some cases like this. Okay, when it is like this, then in the lower meniscus, when it is like this, then this is called lower meniscus, upper part upper meniscus. So for here we use lower meniscus for correct estimation. And then for correct temperature difference, add or subtract 0.01 for every 3 degree difference from calibrated temperature. Okay. Now for low specific gravity diseases in which urine will be low specific. Diabetes insipidus, renal failure, and high specific gravity will be found in diabetes mellitus and dehydration. So determination of specific gravity of urine. You can write this point. So specific gravity is a constant temperature. Specific gravity at a constant temperature is the ratio of weight of volume of liquid to the weight of same volume of distilled water. Specific gravity of urine is determined by an instrument or apparatus called urinometer. Specific gravity of urine is equal to weight of 1 ml of urine divided by weight of 1 ml of distilled water. Here we have discussed correct for temperature difference. Okay, we'll add or subtract 0.01 for every 3 degree difference for calibration temperature. So if the temperature of urine is higher than the temperature of calibration of urinometer, each and every urinometer gets calibrated from the lab. From previously it is calibrated. So let's say if when the temperature of urine is higher than the temperature at which urine is calibrated, urinometer is calibrated, 0.01 is added to the observer's specific gravity for every 3 degree rise above 15 degrees centigrade. So considering that urinometer is calibrated at 15 degrees centigrade. So when the normal sample of urine, let's say normal sample of urine is at room temperature, that is 27 degree. So when it is compared with the calibrated of 15 degree temperature, then what we do? Suppose urinometer is calibrated at 15 degree temperature and urine is 27 degree, and after that we observe for specific gravity, that is 1.012. Then corrected specific gravity will be calculated as follows. Difference in temperature. 27 degree is the normal sample. Okay, and 15 degree is for calibrated one. So the difference is 12 degree. So we get one value. So we have to correct it to our normal temperature. The correction value will be added in observed specific gravity is equal to 0.01 into 12 degrees centigrade divided by 3, that is 0.04. So corrected specific gravity will be the observed, that was 1.012 plus the calibrated part, that is 0.004, that is 1.016. Similarly, if the temperature of the sample is below the calibrated one, here we will minus that calibrated extra part. So difference in temperature is temperature of calibration, calibrated urinometer was 50 degrees centigrade and the sample was 12. So difference is 3. So for correction we get 0.001 into 3 divided by 3, that is 0.001. So corrected specific gravity will be the observed specific gravity minus correction value. Then we can get the corrected value. So this is meniscus. So how to read? The correct is you have to view horizontally. Okay. And that part is meniscus. Here we can see the value. So sediments, formation and deposits. After centrifugation, urinary sediment is examined microscopically. Common deposits that can be found normally in urinary epithelial cells, RBC and WBC. This will be found in very trace amounts, RBC and WBC. Crystals like oxalate, phosphate, then karsts are like hyaline karst, granular karst and cellular karst. Then bacteria or yeast if it is present in the urinary tract. Presence helps to diagnose urinary, renal and urinary tract pathology. So these are the types of cells that can be found. RBC can be in trace amount can be found, or if in glomerulonephritis or during normal, if a person is running then or doing a strenuous exercise, then normal or little amount of increased RBC can be found in urine. In pregnancy also, little amount of RBC can be found. In hypertension patient also, this can be found. So dysmorphic RBC can be found. WBC, reticulocytes, then squamous cells. Squamous cells means normal epithelial cell linings. Then karsts are hyaline karst, fine granular karst, WBC karst, RBC karst. We will discuss about this karst. Then crystals are calcium oxalate crystals, uric acid crystals, struvite crystals and cysteine crystals. These crystals, if they are found in urine, that means there is a pathology. If these crystals get deposited slowly in our bladder or in kidney, then their deposition will result in stone formation. Tiny tubular shaped particles found in urine that formed in kidney tubules and are made up of various substances like protein, red blood cells and white blood cells. The presence of urinary karst signifies a problem in the kidney. They are formed in the kidney tubule and indicates a range of conditions like kidney diseases, infection and injury. So there are certain diseases in which specific urinary karsts are found. Like you will see here, hyaline karst is found in normally or non-specific or exercise. Granular or muddy brown is found in acute tubular necrosis. Fatty karst is found in nephrotic syndrome. This is a type of disease. Then WBC is found in pus cells. These are found in intestinal nephritis or pyelonephritis. In infection of kidneys, it will be found WBC. RBC will be found in glomerulonephritis, vascular diseases, Goodpasture syndrome, SLE. Then epithelial cells can be found normally also. And UXC karst will be found in acute kidney injury and end-stage renal disease. Then clinical examination of urine detects abnormal constituents of such as protein, glucose, ketone bodies, bile salts and pigments. So you can write this part. Protein, how to detect protein? In lab, you will be doing this heat and acetic acid test, in which urine sample will be taken and we will heat this sample. If protein is there, then it will form a coagulum. Okay, it will precipitate. And then if still you are confused, then we add little bit of acetic acid to make it a little bit acidic condition, where urine will be, if protein is present, then precipitate will be more dense. Then for glucose, we do Benedict test. Then depending on the concentration of glucose present in urine, the color, it will give different types of color: green, yellow, orange, red. We can grade them by +1, ++, +++, Then we have tests for Rothera test that we will be doing in the lab, where on mixing reagents, if there is ketone body in the urine, it will form a purple ring. Beautiful purple ring will be formed at the junction of the two liquid. Then there is Hay sulfur test for bile salts. And then for bile pigments, we have Foucher test. Can you tell me what is the normal threshold for glucose in our kidney? Glucose excretion normal threshold, above which the glucose will be excreted. If blood sugar in our blood, that is glucose in our blood, exceeds the normal limit threshold, then it will be excreted by a kidney. This is 180. Okay. 180 milligram per dl. So, qualitative tests for organic constituents. Here we do urease test for urea. Then for uric acid we do phosphotungstic acid test. Blue color will be found. Then for creatinine, Jeff reaction where orange red color will be seen. Then on hippuric acid test, on eating HCl crystals will be separated. Okay. And ammonia can be detected by smell or litmus paper. In summary, urine analysis includes physical, chemical and microscopic examination. It provides vital diagnostic information about kidney function, hydration, metabolism and systemic diseases. Interpretation must be correlated clinically with history and biochemical findings. Why there is the necessity for biochemical correlation with laboratory test, clinical correlation with biochemical test? Can anyone answer? Why do you need to ask patient about history to correlate with the biochemical test? For better treatment. Anyone else? For better? And any other? Number of? Okay. Let's say you have taken dal, chicken, and you have attended a party. Okay, you have taken dal, chicken, rice, fish in lot amount, and the next day you go for uric acid test, blood glucose test. So your result won't be accurate. Okay. So like similarly, we have to correlate with the history. And then you are taking certain drugs, like you heard of TB. In TB we give rifampicin, which gives orange to red color urine. So if a patient is on TB treatment, anti-TB treatment, then you have to give the history to the biochemistry technician or who is doing that it is a TB patient and undergoing ATT, anti-tubercular therapy. Okay. So urine analysis include physical, that is visual. By visualizing you can diagnose little amount. Then for chemical tests you can do, and then microscopy for RBC and then stones, all this. Then it also provides a vital diagnostic information about kidney function. Okay. Then hydration, metabolism and systemic diseases. Do you know what is creatinine?
So it's a byproduct of creatine.
Creatine phosphate metabolized to creatine. Okay. So what do we test this creatine for? In kidney function test, when a doctor prescribes kidney function test, then it has most important is creatinine and urea. So in
I have a question.
okay.
If we take extra creatine,
Uh,
like supplementary creatine, will the creatine level increase?
yeah.
So isn't that an inaccurate indicator to a disease?
Yeah, that is why the patient history is
So we
important.
have to mention that.
Yeah.
Creatine is-
Yeah, creatine, you are taking creatine supplements. So creatine is normally filtered through the kidney. So in certain diseases, like end-stage renal diseases, then creatine will be start to accumulate in the body. So we'll do serum creatinine. Okay. And what's the question? If creatinine is high, we do creatine is urine, excreted in urine. So our body maintains a normal level of creatinine at normal persons. So if kidney gets damaged, creatine won't be excreted. So in our blood, it will be increasing. So normal is 1.2 to 1.3, 1.3 like for males, and 1.1, 1.2 is for females. Okay. So if our kidney gets damaged, then to excrete, we won't be able to excrete creatine and all those uric acid, urea, these nitrogen metabolites, protein metabolites into nitrogen compounds. So what do we do? Dialysis. Okay. Kidney gets damaged, then we do dialysis.